the focus today is, at least from my perspective and the work that we're doing in my lab, is on developing solutions that can build a smart and connected community that's at least virtual in some senses, but actually augmented reality is the more appropriate term, where we can do augmentation of some of the healthcare systems to provide appropriate, timely therapeutics and diagnostics for autism. Again, because it's one of the most pressing public health challenges that we face today. It's one of the most important pediatric concerns, and it's filled with a lot of unmet need, which is really highlighted here by this slide, where you can see that the blue dot, in this case, the blue dots are care centers that provide either diagnostics or therapeutic behavioral care, and the red dots are the estimated prevalence of autism in the United States today. So you can see there's already a geographic disconnect between people and places where they need to go, and that geographic disconnect creates log jams in the healthcare system that can lead to waiting lists that are over a year long to get access to a diagnosis, and then on the other side, once you're through that diagnostic evaluation, 18 months to 24 months to get access to appropriate behavioral therapy. Yet we know that behavioral therapy is very effective. So it's heartbreaking to realize that some of these kids are not getting it in the time that they need it, because the windows of brain development are only so long, and they do close. And the kinds of therapy that has incredibly powerful effect on younger kids does not have the same effect on children that are older. Our question has been, can we identify autism in short home video clips using artificial intelligence on mobile devices rapidly and effectively, so that we can streamline at least that first part of the process, that the first part being pushing kids through the logjam of the diagnostic bottleneck. So we've been doing this in a number of different ways, utilizing mobile platforms to get videos from our stakeholders, that is kids at risk for an autism diagnosis. And then we perform a semi-supervised machine learning process in which raters actually score various features that are used to generate a vector that gets passed through a machine learning algorithm, in fact, several, to generate a score. And that score not only indicates the probability of autism, but it's a continuous score that fits a distribution that can tell you just how severe that autism phenotype actually is. This is very unique in the field and quite powerful, but what's more important perhaps is that it's done in minutes as opposed to the many hours that it takes today, and it's done on mobile, so therefore it doesn't require that you go to a clinical facility where there are long waiting lists. Knowing that there is an imbalance between the number of clinical care providers and kids in need, we wanted to move to a mobile platform like we had with diagnostics. And at the time, I think Martha started alluding to this, the Google Glass system was available on the market, and my student, Cataline Voss, and I we got together through a serendipitous alignment of the stars at Stanford. Terry Winograd and Carl Feinstein and Cataline and I got together and hatched this idea of utilizing augmented reality in the form of Google Glasses to provide continuous care in the home environments of children with autism to safeguard against gaps in access. Now, this also highlights the opportunity to move along these axes where we're getting to a point where we have a far more scalable system that's much more ubiquitously available, and I'll get to that if I have time. But in each of these steps, we also have this increasing need and opportunity to use artificial intelligence. So using the augmented reality form factor embodied in glass, we were able to capture the world around the child and then provide real-time feedback in that heads-up display, the prism on the right side. Notice, though, that these glasses are obviously hands-free and they're lensless, so they're very non-invasive. Not virtual in this case, but augmented reality, which is good because it orients the child towards the social world right in the time of need, right when they need to be looking at a face and understanding what's going on. This is what's going on behind the scenes. This is the facial action recognition system in process. And we have an emotion classifier that we've built. This is a convolutional neural net that works in real time on the devices. In fact, it does so primarily from the Android device, where we can store activities, we can store videos, and we can provide, through that, as a consequence, more holistic therapy, because we can let the parents and children sit down together at the end of the day and review what went on, and highlight times where a child did or didn't understand the emotional scenarios that he or she faced that day. This is exciting, and more importantly, the kids love it. They refer to this as their superpower, their spy glasses, and they wear them, not all the time. It's not meant to be a prosthetic. It's an ephemeral learning aid. So I should say that after 6 weeks of use, they were able to take the glasses off and go on to engage in their social world on their own. So exciting. We published this, and then we licensed this to Cognoa as well as a two-part solution. So we have the diagnostic that's mobilized as well as an augmented reality therapeutic. Now, I should say, though, there are limitations. It's not always going to fit on the child's face. They don't always want to wear the glasses. I mean, some kids have sensory processing issues and they don't like them. More importantly, perhaps the AI that we are utilizing is tuned to the adult and not to the peer groups, and therefore fails on children. This is true across the board. There aren't as many training data sets out there that would enable AI to work well in the pediatric population. We were inspired by Ellen DeGeneres' game called Heads Up, where you put the phone on the forehead and it shows a prompt on the screen, and the job of your social partner is to act out what's being shown. And you can choose among a series of decks like those that I just showed you. And if you can guess correctly, you flip the phone down, it brings up the next prompt. If you can't, you skip by flipping the phone up, and on you go. The cool thing about this is that it's actually probably more potent, more therapeutic than the glass system itself. And it's still a form of augmented reality, but it encourages pro-social behavior and pro-social interaction between parent and child. We can automatically identify the moment in time where a label corresponds to a prompt. And in so doing, we can populate an image library of emotions of children emoting during gameplay. We could do more with these kinds of features, ultimately making AI automation of very important autism features possible in real time on the phone.